day everyone, I am Lyan C, and for this video, we are going to assess the chest and the lungs of our patient. So, let's find out how to assess the chest and lung of our patient. First assessment is that we are going to inspect the chest, the configuration of the chest of our patient. So, as you can see, it is the symmetric ang iyang koan. I mean, the scapula is symmetric, and then also there are no protruded, and the shoulder has an equal position here in the scapula and then the chest of our patient. So that's it. So next is we are going to inspect some retractions and then bulging of our patient. So as you can see, this is the sternum and then of our patient here, and then ang midline siya because nariyang kondria. And then also there are no retractions, and then some intercostal spaces that are bulging on it. So sir, hingaog ko sir, normal lang. Alright, so normal diri ang iya koan diri. Sa ato paminaw sa koan. Kung normal ba imong pagbinas. So, diri midline. Okay, sige sir. Then neck. Alright, so normal ra ang iyang paghinga. And then there are no retractions and bulgings are intended on the assessment. Next is for this video, we are going to inspect the depth, the rhythm, and the quality of respiration of our patient. So this is where to take note the breathing pattern, and then the characteristics, and then also as well as the rhythm, the depth, and then two accessory muscles and client's positioning by breathing. So now we are going to start. So now I'm gonna use the stethoscope for our patient, and then this is where to determine the breathing of our patient. Relax ata sir ha. Breathe lang ka normally sir. Alright. So okay. Breathe sir. Inhale. Exhale. Then sa takal likod sir. Breathe sir. Inhale. Exhale. Repeat. Inhale. Exhale. Alright. So, ito na sir. Alright, we are now going to document the findings as we assess the patient to inspect his depth, the rhythm, and the quality of respiration. So, sa iyong pag-breathe naman sa regular naman sa siya, and then also, relax naman sa diyang pag-breathe, wala something abnormal findings na nakita. And it's so effortless to know. Then also, effortless and quiet with the use of accessory muscles, the way he breathed. And also, the normal depth rate was 10 to 20 minutes. So, pero di man to kadali raman to basta as long as I can hear the breath of the patient nga normal ra siya, and then so that's it. This is the normal finding of our patient. Next is we are going to assess or to palpate the chest of our patient. This is where to determine the tenderness and the sensation of our patient, and to take note the warmth, the pain, and other sensation on this. So I'm using gloves, but to palpate, I will gonna remove this to determine the warmness, and then if there is a pain also. So let's now assess. So alright, we are now going to palpate the chest of our patient. So first is here. So we are going to palpate some the anterior thorax of our patient. So first is here. So
Wala.
Wala. So, alignment man sa siya. Align. Dapat naka-align. May side, sir?
Wala.
Yung nakaugnay sa kita sa lagay sa...
Wala. 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 Wala.
So, next is we are going to palpate the back, the posterior of our patient. So, sir. Ito bang, sir? So now, nakatalikod na nga ito pasyente. So, I'm going to palpate now with the sequence also for the palpation of posterior thorax. So, ingnan ako, sir, if kasi sakit na kit, sir. Wala, sir? Okay. So, naka-align gihapon. Wala, sir?
Wala.
Next.
Wala. Wala yan.
Align gihapon.
Wala.
Wala gihapon, sir.
Wala.
Alright na, sir. Okay na. So, now we are going to document the finding of our patient after we palpate the anterior and the posterior of the chest of our patient. As we now document the finding, we have here that there are no tenderness and then also pain kay woman said na sakitan as we palpate the patient, and then also unuseful sensation that are reported. So also the temperature is equal bilaterally, so bali warm man sad siya, symmetrical po ang iyahang kanang temperature sa iyahang body. So that's it. So it means that our patient has a normal finding. So alright, next is we are going to palpate the crepitus of our patient. So this is where to note the crepitus sensation of our patient. So, I'm done for palpating ganina. So, kada akong gipalpate akong patient. And then, as what I document earlier that there is no pain. So, it means, the document finding of our patient is that it means there are no crepitus was palpated or was noted in our patient. So, it means that kay crackling man nga, wala man siya nasakitan ka ganina. So, it means, wala man siya crack nga na kuhan ka ganina as we palpate. So, it means that our patient has a normal finding. Next is we are going to palpate the fremitus of our patient. So, it means that we are going to note the symmetry and then also the intensity of the vibration. So, by following this is that we are going to follow the sequence of our patient and bali the kadong sequence sa ganina as we palpate the chest, the posterior and the anterior thorax. So this is where to identify the regions of the lungs and then also the intensity as the vibrate. So I'm done for palpating kaganina. So normal naman sa siya symmetric ra pud ang iyang position. Ma-identify rin sa nimo ang lungs and then also ang iyang vibration is that the bali decreases the intensity at the basis of the vibration of the lungs. So that's it. So it means that there is a normal finding that we can identify the fremitus of our patient. Next is we are going to palpate the chest expansion of our patient. So as we palpate kanang unahon nato ang anterior chest expansion of our patient. So bali diri adapit. This is where to determine kung 5 cm ba siya ang iyang kalayon. Then kung symmetric ba siya. Naisakit, sir? Wala. Alright. So, talikod lang, sir. Next is we are going to palpate the posterior of our patient. So, di ba sa katong pag-palpate na to dito kaganina na siya sa ibabaw. So, naria is there siya to dapit. Siya. Sa nari sa bus. So, same message siya. 5 cm. Then, makakuan. Alright. So, so now we are going to document now the finding that our patient has a symmetric and then also 5 cm apart anteriorly and then posteriorly. So that's it. Our patient has a normal finding. So next is we are going to percuss the patient's chest, the anterior. So we are going to note the percussion tone and then also the anterior and the posterior thorax of patient. So first is the anterior lang sa unahon nato sa pag-percuss. So, first is here, same magyapon the sequence of our percussing in the anterior thorax. So here, first is here. Kung bagbating na tone. So, kung sakit ba gyapon there? So, realignment and then also here. So, busa to, may then alignment niya rin. Then also here. Next is we are going to percuss the posterior of our thorax of our patient. So then we were gonna follow the sequence starting right here, then here, and then katingnan dire. So mag-start na ta. So start is here. Then una ko sir kung naisakit. Side percuss. May sakit, sir? Ayan. Next is here. So, man ako ngari. And then, here na sad. So, man ako nga rin. So, it means nga rin na po na ito nag-determine na to. So, wala yung sakit, sir?
Wala.
Alright, so now we are going now to document the finding of our patient. As we document now the finding of our patient, there are no pain and then it is symmetric. And then also as we percuss, the document of our finding of our patient is that there are resonant over all the lung fields. Kaya kadong the percuss earlier is that it's a field of the lungs kung asa dapita sila. Right? So, wala man sa mga something nakuan na observe as I percuss. So, it means that our patient has a normal finding. Next is we are going to auscultate the breath of the sounds of our patient. This is where to note if there are any presence of the location of the bronchial and then also the bronchiovascular and then the vesicular breath sounds of our patient. So, we are going still to follow some sequence na kung asa dapat paminaw na to by auscultating using a stethoscope of the breathing of our patient. So now let's proceed. So after nga ito mabatian. Okay. So, let's start in here. Inhale, sir. Straight lang pa, sir. Straight. Here. Inhale, sir. So, I'm done for the auscultate the posterior of our patient. So let's proceed on the anterior of our patient. So now I'm going to auscultate the anterior of our patient. But we are going now to follow some sequence also. Ito ba nito, sir? So it started here. So next is here.
Ay.
Now I'm going to document the finding of our patient. So as I can see that the bronchial sounds was noted over the trachea, and then also the bronchiovascular vesicular was over the major of the bronchi, and then the vesicular was over the peripheral lungfield. So okay naman, normal ra ang iyang breathing sounds, and then also kasagaran jud nga ang iyang breathing sounds was kanang mas kusog ang S2 niya, systolic 2. So that's it. So it means that our patient has a normal finding. So next is we are going to auscultate the adventitious sounds of our patient. So this is where to note if there are presence of some crackles, some wheezes, some pleural friction by rubbing of some, just like wheezes, like I said. So as what I've heard earlier, there are no some crackles or some wheezes that are determined. So it means that the adventitious sounds was not noted of our patient. So it means it is normal. The sounds are normal. So it means our patient has a normal finding. Next is we are going to auscultate. So the very first is to auscultate the voice sounds of our patient. So it means that this is where to note the bronchophony, the egophony, and then the whispered pectorilloquy of our patient. So As what I've also auscultate earlier, so the voice sounds is that we are now gonna document na lang the finding, direction that the bronchopnea of our patient has soft, and then also some na siya muffled, and then indistinct ang akong napuminos, and then also for the egophony, and then the soft, the muffled, and then yes, there's a letter imrog na siya mo kay na siya ba, and then distinguishable ang iyang pagkuan, and then some whispered pectoriology, and then it is mean that very faint, and then also muffled ang iyang voice sounds nga ako nabatian sa iyang kuan. So it means that the patient has a normal finding. So that's it for assessing the chest or the thorax, and then also the lungs of our patient. So thank you for watching, and God bless.